Good morning. I am BC Mole with you, and today we would learn something which is an ooh ah ouch every day in your life. Something which affects our daily living. It is all regarding our knees. Our knees basically are made of 4 important muscles in the front and 3 muscles at the back. The 4 muscles are called the quadriceps and the muscles behind are called the hamstrings. The knee pain often happens when this group of muscles, called the quadriceps, becomes weak. There are several factors which might really cause this problem. It could be a person who exercises too much, or a person who is obese, a person who has injured his knees due to several other factors like falling, over bicycling, or even lifting something wrong over a repetitive period of time. So now let me tell you some very simple exercises which you can do on an everyday basis without much effort going to a gym or by just sitting at home. Are you ready to take up the exercises? Let me begin going down on the floor. Sometimes you might be feeling very difficult to walk down on the floor, just squat. However, you may use the help of a stool to come down, something like this. But this could be also done not going down on the floor, just being on any hard surface like your bed. So it is not really necessary that you have to go down onto the floor. Okay, sit in an upright posture. Make sure your knees are in front of you with a slight widening of the lower limbs, something like this. The first exercise is very simple. This small bone on your knees is called the kneecap. The exercise that I'm going to teach you is make sure your kneecap moves towards you, something like this. To do this, there are different ways. Just by keeping your hand, just to see whether it works, push your knees onto the hand, which will show you some kind of contraction. And that is how you push your kneecap towards you. So let me start without anything under my knees, just push downward. When you do, try to always do for both the legs at the same time. Keep your hands on the back, something like this, so that your back is straight without causing any much strain to your back, and push your knees towards you, something like this. Now do you see the muscles, quadricep muscle being tightened? You may also use your pointing finger to feel the tightening of the muscle. Yes, something like this. So this was just the first simple thing, just to push your knees down. The second way to do this is while you push your knees down, try to lift your foot off the ground. Do you see the gap under my heels? Relax. Try to do for about 30 times. Repeat this exercise 30 times. Let me show you something like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. After 10 repetitions, just take a pause and breathe in and out. Are you ready to go for the next set? There you go, start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Breathe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This ends up for the first simple exercise. Either you may just push the knee downward, or lift the leg, that is the foot end or the heel end should be off the ground, or also you can augment this exercise with your ankle towards you, something like this. And relax. Do you see? This towards me, relax. So this is 3 different ways you can do this exercise. Let me repeat it for you. 1, just push the knee down, which doesn't show a complete contraction. However, you can feel the tightness of the muscle and you can see the kneecap towards you. The second one is, while pushing, try to lift your heels up the ground, something like this, which gives complete contraction. And the third one is to push, lift and ankle towards you. So the same exercises could be made gradually or progressively stronger by doing this. So do you see this? And relax. Try to hold it for about 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Just by doing about 3 times with a repetition or a contraction of 10 seconds, the isometric contraction of 10 seconds, you will start feeling a slight ache in this muscle. That shows you have done maximum contraction. So are you ready for the next set of exercise? There we go. Now, let us do this exercise in a sitting position. So for the people who don't or can't come down onto the floor, you may use the bed as I said to you, but make sure the bed is a hard surface. It could be a long bench or even a long table where you could do the exercise that I showed you on the floor. However, you don't have to always choose a bed to exercise to feel that you are always exercising. Instead, while you watch a TV, you can still exercise for your knee problem. How is it? Please do not use a couch for exercising because this is very soft and that might cause a back pain when you try to prevent your knee pain. So always make sure your surface is hard. Okay. You are sitting on a hard surface, keep your back straight and try to lift your leg up, that is by knee extending. Again, this could be just lifting straight. Let me show you the side view. It could be just like this. Again, you can feel your thighs with your pointing finger or the whole hand just to feel whether it has become tight. The major cause of pain here is because of the weakness of this muscle called the vastus medialis, which is actually the locking muscle of the body, especially locking of the knees. Let me do the exercise for you. Just lift, straight, hold. 1, 2, 3, 4, 5. Bring it down. The same exercise could be augmented with the ankle movement. Something like this. The ankle is dorsiflexed or moved towards me, which would also strengthen these muscles, or it will cause a stretch to the calf muscle. So you can augment it with the ankle movement. Let's repeat it for 10 times. Are you ready to go? There we are. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Well, I didn't go for a concentric or isometric contraction here. Let's see. 1, hold. 1, 2, 3. Down. Same thing could be repeated over on to the next leg. So please try yourself doing these exercises, which would help you definitely over a period of 3 weeks if done on at least for 5 days in a week. All the very best and see you without any knee pain. Good day.